All right, you guys, we'll start it off with just questions. Does anybody have any questions or anything that they have on their mind, anything they want to discuss?
I actually do have a quick question. And maybe this is kind of a dumb question, but so I was just looking at like my funding for over the 3 years and stuff. Does the funding have to specifically stay to like every year, or can you kind of like, let's say you use a little bit more the first year, and then is it overall, or do you have to stick to that per year amount?
That is a very good question. You stick to it by year. So it's the 62,500 per year. If you use it all that year, then you use it all. We can't go over that 62,500 per year.
Okay.
And then if you don't use it, it has to get reallocated because there's a certain amount of money that we have to spend in prevention every year. So we have to reallocate it and get that spent. So it does get reallocated. So it's 62,500 per year. Does that answer your question? That's good.
Yes, I was curious about that since this is kind of the first year. It's been multiple years with. So thanks.
Yep. I think most of you are on target to meet that reimbursement amount. So it was really good to see. I think there's just a few where we haven't been able to reimburse just because I know Callie's waiting on some strategic plans. So just make sure if you haven't turned in your strategic plan to turn that in, and then she can get you reimbursed for some of those months. All right, so I'll just get started with some updates. You guys can chime in at any time. We have the SAPS meeting next week. I know there's quite a few of you registered for the SAPS. It is here in Bismarck at the Sleep Inn and Suites. They have a nice little conference room. It's Tuesday through Friday. There is a pre-course that you have to take. So if you're registered for SAPS, make sure you complete that pre-course. And I think it's only a couple hours long or something like that. But it gives you some background into SAPS and some of the prevention and stuff like that prior to coming to the in-person. And I believe the in-person SAPS starts at 8 a.m. on that Tuesday morning. So 8 a.m. There was a blocker room at the Sleep Inn and Suites, but I believe that they're not held anymore. So just know that blocker room might be done. And I think registration's closed. So I think we're full. All right, so then we can talk about our June in-person meeting. That is coming up on the 17th and 18th. So make sure you block that on your calendars, June 17th and 18th. We are going to go over strategic plans and help you come up with some next steps if you haven't done so already. So just be ready to talk about your strategic plans and your strategies and putting your plan into action, because that will be the basis of that June in-person meeting. I know that Amy Lisa is going to get some information out to you guys about maybe a few hours for SOAR discussion and maybe some training opportunities there on the second day of that in-person meeting. So just know that information will be coming. I see Amy is on, so if she does have anything that she wants to say, she sure can. But yeah, there you are.
Hi. Nothing super set in stone yet. Still working through details, but thinking it might be a good opportunity if we can do just a little bit at the end of the second day, if Tom wants to share some of the time with us.
Absolutely. Yep. So be ready to talk a little bit about SOAR on the second day. If you're not a SOAR grantee, you're probably going to be able to leave early. So just know that that'll be kind of nice too. So, all right. So then we have our next our prevention community of practice meeting on May 20th. That's the planning meeting. If you want to be part of that planning committee and come up with the next topic for the community of practice and that kind of thing, make sure to email me if you're not already on that meeting invite, but it's on May 20th. So that's community of practice. That first one went over really well. We got your guys's surveys back and things, and everybody seemed to like that one. So we're going to keep doing these. I think they're great. So I was going to give you an update. The Behavioral Health Conference, you guys should have got the meeting invite the save the date for that. It's September 16th through the 19th this year. It's in Bismarck again. And there are going to be a couple prevention sessions. I think there's about 2 or 3 that talk specifically about substance misuse prevention. So might be something to look for. when the agenda comes out, and maybe attend if you want to. It is covered by our SUPTRS funding. It is one of the qualified capacity building activities. So another thing is growth partners should be reaching out to you guys. Kai has been sending emails for doing some of that planning with those regional events. So in the contract with growth partners, as you guys remember, we have 8 regional events that are supposed to occur sometime this year, early next year maybe. This is a time for you to build capacity in your communities. Again, you can think outside the box. I know that working regionally is kind of difficult, to find a specific time and a specific location that works for everybody. But this is the best we could do. 8 regional events. You guys are able to work with whoever you want and have these wherever you want, as long as there's eight regional events. So just know that's what some of Kai's emails are. She's looking for a time to plan some of these things with you. It's their responsibility to bring in like presenters and speakers and things like that to help you build that capacity. Be creative again, like if I just heard like some of these prevention, I listen to these prevention podcasts while I work, and they're really good. And I sent you guys all the link to those prevention podcasts. There's some really good ones, but they are some really good presenters that talk in these podcasts, and they cover things like risk and protective factors and community prevention efforts and all these different things. And these are some of the speakers that you could potentially bring in and maybe have them cover a topic like that. So just if you're not listening to some of those podcasts, I highly recommend it. There's some really good ones. You can listen to them in the car or whatever, but definitely good ideas for presenters. The one I really liked was Rodney Wambine from WISAC. He's really good at talking about prevention basics and things like that. But maybe we could bring him in for some of these regional events. I don't know. It just depends on cost with growth partners and things and how things are planned out. But one of the podcasts did mention something about, they got their best attendance when they did this as part of a church service. So they said that they like a lot of these podcasts talk about how do you get people involved and like the barriers. And when you talk about alcohol prevention, nobody shows up. So you have to meet them where they're at. And one of them said they brought in a presenter to a church, and it was part of the church service. And I was like, that's a great idea. You'd at least get 50 to 100 people in attendance, So it's something that you guys could do as well, include the faith communities and things like that, because there is people, groups of people that attend, and it'd be a good way to get them where they're at. So think outside the box. Could be an orientation class for the teachers and maybe for the coaches, it could be in services. I mean, just anything. Getting people to these events is always difficult. So then I was going to tell you guys about SINAR. We do have the request for proposals out currently, and we are looking for a vendor to complete these surveys. They will be done anywhere from June through September of this year. So we do have the list of retailers that will be checked. I will be including some of you guys on the communication, but we'll be doing those site visits again, where we just talk to the retailers, letting them know that this is something that we do every year and we want them to pass. And I will ask for assistance again, like I do. So be looking for that email. We have, I think, 393 places to check this year again. So it's a lot. We do check quite a few of our retailers. Let's see. There is a conference we're going to in August. It's the National Prevention Network Conference. This is something that you guys could also attend if you wanted to. It's a very good conference for prevention professionals. The conference is August 13th through the 15th in Arizona. I'm not looking forward to that. I will not leave my hotel room, but it is a really good conference. So I guess I should say I'm not going to leave the hotel. I will leave my hotel room, but not the hotel, because it's like 150 degrees in there. So can you send us the info on that conference? I sure can. Yep, I'll send you that info.
I don't think it's usually 150, Tom.
Maybe not 150, but it'll feel like 150 for Tom.
Yeah, but it's dry heat.
Yeah, that's what I've been told. We'll see. We'll see if that makes a difference. I'm going to start acclimating myself right now. I'm going to turn off the air conditioner this summer just to start getting ready for it. So I don't think there's such a thing, Megan, as a nice heat. I'm just going to say, Don't think there's such a thing, but okay. We'll give it a try, I think. I didn't I didn't think there was any way in heck Laura was gonna be able to get me to go to this conference, but here I am. They do have a water park, so maybe I'll just spend all day in the pool. We'll see. Let's see. Oh yeah. So somebody living in Arizona, you know, you were acclimated. That's why you think it's a nice heat. You were acclimated. Tom's in North Dakota, born and bred. I don't know if there's acclimation to heat or not, but another update, server training. We do have that contract with Safety Council, so just make sure if you have any needs with server training, they're available. They can do train the trainer courses. They can do the free online courses for staff. They're doing some promotion right now to try to get more people taking the class. So just know that we have that contract up until the end of September. And then we're going to probably look at renewing that contract, hopefully, if procurement allows. So there's that. I know we're going to be doing a lot of state media in these next few months. We're reworking some of our prevention materials. You know, if you've ever watched our prevention video, our prevention basics video, we're going to redo that one, or not really, we're going to update it, I guess. We have some parents lead stuff that we're updating. So let's see, have you heard of any dates for in-person server training? I have not, Caleb, but I can reach out to Safety Council just to see if they're doing any in-person events and things like that, and I'll get that information to you guys. Let me just make a note of that so don't forget. Okay. I am doing a presentation tomorrow in Lemoore for forensic scanners and fake IDs. So I will be out of office tomorrow. But if anyone's in the area and they want to attend, they sure can. I'm just going to be running over the demonstration of these forensic ID scanners. I'll bring some of the fake IDs to show. And then it's pretty much just a really good little training day. And I can do this for you guys too if you ever wanted. So if you are implementing, you know, some of these forensic scanners and you want to train staff on how to use them or anything, I can do that. So that training will be at 1 p.m. at the courthouse. That's in Lemoore. Any other, I'm trying to think if there's anything else. PFS. So we just completed our first quarterly progress report. We are in the process of finalizing that needs assessment along with identifying which communities are going to be eligible for the funding. It's going to be more funding than what SUPTRS allows, and it's going to be for 5 years or like 4.5 years versus the 3 years. But there are going to be some requirements again, like there is going to be a requirement for full-time staff that's dedicated to the PFS work. There's going to be only 5 communities potentially that are eligible. So it's going to be pretty limited, and it's going to be based on those selective strategies again. So it's, I mean, the selective populations that we had to identify through data, it's going to be college students, youth who are living in a house with a parent with a substance use disorder, and then it's military. So those 3 selective populations play a big factor in who's eligible for this funding. It is quite a bit of work. Again, there's a needs assessment process that has to be done. There's a capacity building process. There's a strategic, did I say strategic planning? Yeah, I did. And then just the implementation of those strategies that are targeting those selected populations. But you'll have an opt-in, opt-out. So once the announcement's made to the 5 communities, they have the option to opt in or opt out. And then if somebody opts out, depending on the time and stuff like that, we might go to the next person on the list, or we might just take that funding that was going to go to that person and then divide it out amongst the other 4 that accept the offer. So we'll know more depending on the time frame with PFS. But we should know here pretty quickly, within a month, probably a month or 2, of which communities are eligible, and then we'll be making that announcement. What else do we have? I think that's all I had to cover at the moment. I don't see anything else on my list. Date for prevention, we're still trying to secure a date. I know that we had December 4th at one time, and then December 9th or 10th or something like that, and then all those fell through because of the venue that we're trying to secure booked on us and stuff. So I will know by the end of this week on what day we're planning to have that. So at the end of this week, I'll send you guys all a save the date for that once I know more, once we get that venue secured. Still going to be in December, first week or two in December, one day there. So now I'll leave it up to you guys. You guys have any questions? I do think, I was another update. So like, I know with Growth Partners, they have that planning committee for the community of practice, but in their contract, they have some deliverables such as the creation of handouts, the creation of radio ads, the creation of social media ads. And we are wanting some people to help design and review those documents. So if you are interested in helping create these, review these, and do that kind of work, please let us know, because we're thinking that we might ask the community of practice planning committee to help us with that. But if you're also somebody that would like to help, let us know who that would be, because we don't want to stall it here. These documents and this contract is for you guys. So if there's specific topics and resources that you need, I want you to work with Growth Partners to get those completed so that we're not the holdup. I don't want, because our review process takes a long time, and it would be a lot quicker if you guys were the group that helped design these and review these so that you can get them out to your communities. So email me if that's something that you're interested in. I would love to get a few people to help put these together and review them, because there's a lot of good things that you guys can do with this Growth Partners contract and some deliverables in it. What else do we have? I think we're trying to also work on, well, I know I'm working on it. It's a compliance check training. So it's something that we're partnering with tobacco prevention and alcohol prevention. We're going to bring a trainer in to teach compliance checks to law enforcement. And it'll be, again, 8 regional trainings. They're about 4 to 6 hours long. There will be a classroom style teaching first, like 2 to 3 hours in the classroom, learning about the laws and how to conduct these compliance checks. And then there'll be a 2 to 3 hour portion where it's experiential learning, where we will actually go out in the community and actually conduct compliance checks. So just know that information. I'm working on the contract on that yet, but that'll be out for bids here pretty soon. And we're hoping to do that within the next couple of years to offer some of these compliance check trainings. And we'll put out some save the dates, and we'll get you guys more information once I know more. Okay, so that's what I have. Again, good to be seeing some of you guys at the SAPs, and I know that June in-person is coming up pretty quick. So just make sure you're familiar with your logic models and strategic plans, because that's what we're going to build out in that June in-person meeting. We're going to talk about next steps and operationalize that strategic plan for you.
Hey Tom, this is Abby from sorry, Cindy. Just quick question.
That's fine.
When is the June in person again?
Yep, the June in-person meeting is the 17th and 18th. And we're still booking like the rooms and stuff like that. So there'll be more information coming shortly, but just block it on your calendar, the 17th and 18th.
Okay, thank you.
Yep.
Do we know anything more about at one meeting you were talking about you might have some printing, somebody doing some printing?
Yeah.
Of
Did
materials?
You guys, I'll have to get an update from Tori on that. I don't know if she's on right now, but yeah, we took that big order of printed materials.
Yeah.
And we were going to get that all printed for you guys and shipped out. And I have to find out where that's at. We got an extension on some of the funding that we're going to use. And I know that we ran into some issues with the printing contracts. So I know it got a little delayed because, of course, we have to bid out everything when it comes to getting things printed. So I know that delayed us. Yeah.
Thank you.
I'll get you an update on that. I'll make note of that. And then I'll send it out. Any other questions? In the future, it'll be a lot simpler. We are looking to do a contract with a company that can print and ship to you guys, so that we don't have to go through the procurement process every time we get a big order. We can literally just send the orders to this company. They will print them and ship them immediately. So we are looking to streamline it for you guys because we know it's kind of a pain in the butt to wait for all these materials, and it's a pain for us because we have to procure everything. So,
Thanks.
yep. Any
Tom,
other
I just have a few
questions?
things for parents. Lee, just to update. I just noticed my camera set on.
Heck yeah, I would like to see some of these.
I was eating my breakfast earlier, so I did you guys all a favor and took my camera off. But we do have a activity a day to practice mindfulness. It's Mental Health Awareness Month, and so we did do that for Parents Lead. I can drop the link in here. It's not added on our actual website yet, but it is on Xcart for you guys to share on social media. And then I think Tom was able to get me in on the calendar for the June 17th, 18th training to review our Parents Lead slideshow that we have finalized. I'm waiting to send it out because I kind of want to walk through some things with you guys. So then you guys can share to your communities. I know that's been an ask for some time now. So I will walk through that with you guys in our June meeting, as well as our community toolkit that we had our vendor develop for you guys to help implement within your communities. And then I also have an ask if there's anyone in the Bismarck Mandan area and are looking for some media time. I am looking for someone on Friday, this Friday the 11th. So I know it's a short turnaround, who might be interested in doing a small interview with KFYR TV and just how you utilize the resources within your position. You can feel free to shoot your name below or shoot me an email too if you would be interested. It won't take much time, but you would have to be in person. So if there's anyone interested, please let me know. That's all I have.
Awesome. Okay, so I'm getting to some comments here. Immunization conference. That's too bad. If you guys have some of these conference dates and stuff that are kind of set in stone for you guys, send them our way because we try to take those into consideration when we're planning. And I did not see that there was an immunization conference. I might have missed that one. But if you guys have some of these conferences or big dates that we shouldn't use, send them my way, and then I will get that to Kai so that we consider those when we're planning our events.
Is the in-person in June 17th, 18th, or whatever for us mandatory?
It is in the contract to participate in these, but if it's something that you cannot attend, just let me know. Send me an email and we'll see what we can do. But yeah, I think it would be okay, but we'll see. We'll see what we got. Just send them my way. Because I know you guys have limited capacity for all the work that you're doing. So I think there could be a workaround or something. Let's see what else. X-Card ordering. There shouldn't be a problem with X-Card. I believe it's up and running now with all the materials. If you get to a point where it says an error message about your cart or something like that, or the materials in your cart, it means that you have something that's only downloadable in your cart, and you have to remove that before you can complete your order. So just know that if you're ordering and you get to that checkout window and it says something that there's an issue, it means that you have a downloadable PDF in there, and it's not something that we print. You do have to just remove that. But I believe it's up and running. If you guys have issues with Xcart, let me know what they are, and Tori will be able to troubleshoot those because she kind of oversees that. So let's see. Vanessa had something in the chat. The Prevention Week toolkit. I think the Prevention Week toolkit was getting updated, right, Sarah? The Prevention Week toolkit. Did that get posted on the website? We have been delayed because with the way that the comms team is operating and stuff, we are delayed on some things. So,
Well, like on the toolkit, it says, 2024 when you get in there right away, but then after that, everything has hashtag 2023, hashtag 2023. So I don't want to use it.
yep.
You know what I mean?
Yeah, they were supposed to
Documents all
update all
have
that.
2023 too.
Oh,
Yeah, they were working on
bugger.
updating it. We can follow up with them.
Yeah, let's follow up on that because that should be updated. I know that we sent some stuff over to them and stuff like that to get it fixed. So thanks for pointing that out. Okay. Other things that you guys might have? A few things on my list. I'm going to reach out to the North Dakota Safety Council to find out what their schedule is for in-person classes. I'll get you guys an update on where those printing of materials is at. And then I'll find out what we're doing with that, or when those updates on the Prevention Week information is going to be updated. And then we can send you that. We can send you an email to forward. Any other things? I haven't heard a whole lot about the forensic scanners. I know that you guys are using them and things like that. They must be, I just got another update on my machine, so I'm assuming they're getting things updated and things are, and I haven't heard of any complaints about some of the things that we were dealing with before. Karen, I know that you were having some IDs that were scanning in as fake when they were really not fake. Is that still an issue with some of these? You've been running into anything else?
Well, since I put in the DMV checks that they're able to do, I would say since I purchased them, which probably has been maybe 4 or 5 weeks, they've probably gone through 32 of them.
Wow.
Wow. So I'm sure they're getting some of those and they're double checking them that way.
Okay.
But yeah, it's interesting because I've had to be on the phone with TokenWorks a number of times with it because, like, you know, I had a problem. I got a call like on a Saturday evening from one of them saying somehow they got logged out of the DMV, and it was I was logged in. So then I talked to them and they said it's better if you assign them as a user and they can sign in and take care of it themselves.
Gotcha. That's
So
that's good to know.
Yeah. And so then had a problem. So I asked them to get me their email addresses and a person who would be the one that would take care of it in each of the locations. And I told him, you know, I first have to assign you as a user, but in the meantime, he tried to log in himself. And so then when I went to assign him as a user, it took us yesterday almost an hour to figure out that he must have tried to log in himself so it wouldn't accept his email address. So yeah, TokenWorks and we got to know each other very well.
I will say they have some of the best customer service I've ever seen, by far the best. And they will help you with everything that you run into with these scanners.
He was almost as frustrated as I was because it was a Gmail account with a number in it. And it would take everything. If we changed the number to anything other than the number that was in it, it would have accepted it, you know?
No kidding. Okay.
Yep. So yeah, that's how we figured out it. But he must have tried to log in. So I have to get a different email address from him to get in as a user. So, but I think once we get all those little bugs worked out, it'll be great. Because
I do know that is somebody, Robin asked that too in Fargo, what is the best way to set the DMV checks up and set these scanners up. So it's good to hear that information and that feedback to say that, yep, you should be the one that registers it and then assign these to somebody else. So that's good.
Yep, and then just don't give them administrative privilege.
Yes, that makes sense.
So yeah, and it's very easy to do, you know, once you get logged into the system, it works well.
Yep. And then, so Kayla asked about that. What is the DMV feature? And what that really is just a double check on an ID. So let's say you get a fake ID or an ID that comes in as fake, and the guy's adamant that it's a real ID, it's a legitimate ID, and you can just hit the DMV check button and it'll run it against the DMV database. So if it has the correct information on it, it will be a secondary check for that ID. So if it's in the DMV system and it says that it's a valid ID and everything matches, it will tell you that this is a valid ID, and it works really good. The only problem is Minnesota IDs cannot be DMV checked because it's the only state, I think, in the nation that doesn't have the DMV check feature for it. So just know that I do not believe it works on Minnesota IDs, but it is a really good system. I don't know what the cost is right now. Karen, I can't remember how they set it up because it was brand new. And when I was talking to the guy at TokenWorks, he was saying that they might change it. So I don't know I don't know what it is right now, but it's like $1 or $2 for every DMV check. And you guys are allowed to pay for this with your SUPTRS funding as type like a other type thing with reimbursement. So, and then there was a question for you, Karen. Do you go to the bars and help them set up the DMV check, or do you set it up with your scanner and then hand it to them, or what's the best way to do that?
Well, initially, I thought it would be best if I did it with the scanner in my office and, log in. And that was fine until they somehow got logged out. And then I got called in to go in. And of course, then it wouldn't accept my password. And that's where we ran into somehow, for some reason, it'll accept it on the account, but not on the DMV forensic scanner check. So there was some character in it. So I couldn't correct it.
Gotcha.
So I had to reset the password, and then of course it went to my email. And so I thought, well, this is not fun. So I thought, well, there's got to be a better way. So then I called TokenWorks, and that's when they showed me how I could set them up as users. And which means then I can set them up as a user from my account, my regular computer at work. And then I get their name and their email address, and I can set them up as a user so they can then go in and log in on their forensic scanner. I don't have to be there.
Nice.
But I did have to purchase the credits, and it, I can remember, I think it was a $50 subscription fee, if you will.
Okay.
And then I think it was, roughly like $2 a scan or a credit. So that's kind of what it was.
Okay.
So
that's not so bad.
Yeah.
No, is it $50 for each bar, or is it $50 just to set up DMV on your machines?
Just $50 to set up on the on the forensic scanners.
Gotcha.
Yep.
And then it's $2 after that. So it wouldn't be for each bar. It would just be $50 to get yourself set up with DMV checks on your scanners, and then $2 per scan.
Right. And then you also, as an administrator, have the ability to set limits for each bar if you want to.
Oh, nice.
So that if you think they're kind of overusing it or trying to, you can limit to how much, how often, how many they can use a week, a month, or whatever. So.
Nice. And I do like the idea of having like maybe a training or like maybe just a meeting to talk more about the forensic scanners. So I'll see if I can set this up with TokenWorks to see if they could run us through some of these features, how to do the logins and assigning people and passwords and things like that. I'll see if I can't get that through with TokenWorks. And then we could just set a 1 hour time where we just talk about the scanners and how to do all this. Because Robin was able, yeah, go ahead.
Oh, I was just going to say, when I was speaking with TokenWorks too, I asked them if they had any tutorials. And he said they were actually in the process of updating them, and they were hoping to have them updated within the next month and a half. And so he would keep me in the loop and let me know when those had been redone, because I want to train someone else in it as well here. So I thought it would be good if we could use some of the tutorials to be like, how do you find how many fake IDs they have found, and get your data off of it and see kind of what's going on just for yourselves to know that. So, yeah.
Yeah, maybe like Robin said, maybe this is a good topic for the next community of practice. Like we could talk about the scanners and we can bring in TokenWorks, and yeah, maybe that will be the next one. That'll be really good. I know that the planning meeting for the community of practice is coming up on the 20th. So let's have that discussion there. Don't forget about that. That's a really good idea. Let's see. The next quarterly presentation, I don't have that on me right now. I can't remember what Callie's scheduled.
I have mine written down as July 10th.
July 10th. Okay, I think that might be it.
And then
so that'll be the
October
next
9th and January 8th.
Gotcha. Okay. So the next quarterly, okay. Yep, she didn't send it out to me. So All right, yep. So we'll have that one. Again, we'll have to keep those, PowerPoints really brief. Or she was talking about maybe doing 2 different days, maybe an hour and a half on one day, an hour and a half on the next day to do those quarterly presentations, because you guys are finding them highly beneficial. We hear from you saying that was awesome to hear from what other people are doing. So yeah, maybe we can break those up into 2 different days or something like that. I know that July quarterly presentation is right before State Fair, so we will once again be at the State Fair this year. We are going to have a parents lead booth. We are in the planning process of that. So that brings up that. What were some of the other questions in here? Oh, did you get the free resources catalog? Thank you, Sarah, for sending that out. So that is where you order the free resources, right? I believe the X-Cart shops link is in there. Yeah. Okay, so far I've answered all your questions, I believe. If you have another question, let me know. I am getting a lot of people filling out the surveys for the scanning of fake IDs. If you're not filling those out, if you're not having retailers fill them out, please do so. We use that data to support the additional forensic scanners. And really, we just need to know like the number of scans, like how many fake IDs were confiscated, just a few short questions and things like that, just to help support the program. So if you need that link again, let me know and I can send out that information. I do get a lot of questions about forensic scanners and the law. So I do have, the different laws pertaining to fake IDs and things. So if you need that, again, let me know. Just send me an email. Like one question I got today was, is an expired ID something that they can confiscate? And that is a good question, because in law, it says that it has to be a valid ID for purchasing of alcohol and tobacco products. And I know that an expired ID is not a valid ID, but it doesn't say whether or not you can technically confiscate that. So it was a really good question that was posed, and I'm not an attorney and I can't provide legal advice, but I don't know what you guys are doing with expired IDs. In the past, I've told people just to take them because they're not a valid ID. Like they're supposed to, the DMV is supposed to take those once they're expired anyway, so that they can get their new license. So I've been telling people to confiscate those, but I think it would come down to the policy of the establishment. Build them out. When you say oh yeah, filled them out, I'm assuming you're talking about the data or the survey data for the forensic scanners. And yes, I can send you guys an update on that, on how many people are filling out that survey. I'll just send it to everybody today, and it'll just be like the download of the data to see, who's submitting their data and who's not. So I'll send that out today. I know there's quite a bit of data in there now, so we're getting quite a few people reporting it. Okay, anything else that you guys would like? I know that our ND tip, we are on our last year of the ND tip contract. It is a subscription-based service. It'll end in May of 2025. We are looking to renew that. So we are getting a lot of participation. We're talking about maybe doing some more promotion of the ND tip line, but more information to come on that. I'm pretty sure we are going to be extending for another 5 years. Oh, yep. You're welcome, Megan. I know that I sent out, I believe, 8 to 10 forensic scanners just a couple weeks ago, and I still have some left to mail. I think Lake Region, Standing Rock, Central Valley, 3 affiliated, Spirit Lake, Cavalier, Lemoore. I have some more forensic scanners that have to go out to you guys. And then that's it. Like they're all spoken for already. I might have one left over, but that just depends. Because I sent some to Ransom, Southwestern, Morton, Western Plains, Grand Forks PD, and then Hillsborough Sheriff's Department. And then I'll be sending out some more next week because there were some issues with getting them shipped to us. They had some bad information on the address or whatever. They used the wrong zip code, I think, and they got shipped back to the sender. So now they should be coming here this week. I saw that. I got some more UPS notifications, so should be pretty soon here. But I think I have about 10 to 12 more to ship out. But yeah, it seems to be a really big hit. Like there are a lot of people that love implementing these forensic scanners because they're just so easy and the staff love to use them. It's a mitigating factor when it comes to any, legal issues that they might have or trying to find IDs or selling to minors. So it's been a pretty huge program. Getting a lot of support.
It's kind of good too, because you really hear quite the stories from how people try to sneak into the bars when they're underage. And yeah, it's pretty interesting out there.
Mhm.
Yeah,
That it is.
yeah.
Well, and just the fact that I used to be a bartender back in the day, back in college, and I would not have caught one of these fake IDs. They're so good. I would never have caught them without a machine. Like I didn't even realize that was like my responsibility. I thought, well, if they gave me an ID that looked valid, I was good to go. I was good to serve. And you're not. You have to determine whether or not that ID is valid. That is your responsibility in law. So a lot of retailers don't realize that is their responsibility. It's a good way to actually cooperate, to like work collaboratively with the retailers because often they feel targeted by our prevention efforts. And this is just a really good way to collaborate and get them involved. And like Karen said, learn some of that inside information because that is your but why. Why is underage drinking a problem here? And that's where you're picking up some of that qualitative data saying that, hey, we got kids trying to sneak in, or we had 4 kids sneak in, and then you can actually implement some prevention efforts targeting specific behaviors. So yeah, it's been a really good program.
Tom, did you get those ID scanners then, or?
Yep, they're coming this week, Tammy, and I have you
Okay.
on the list of getting one.
Okay, sounds
So,
good.
yeah, they just got returned to sender. They had a bad address on them. So
Well, geez, it sounds like there's a lot to learn about them too, huh?
yeah, there is, and I can come do a demo with you guys once you get it and stuff like that, and some of the same things I do with everybody else. So
Sounds
yeah, we
good.
can run through the scanner. I can talk about some of the fake IDs, and yeah.
Is Dave and Hank on at all?
I don't know. Hank is getting a scanner, and so is Mardell.
Oh,
So I do
cool.
know that they are on the list for a scanner.
Oh, cool. Awesome.
So it should be fun. Oh, so SAMHSA did announce the next round of SOAR funding. So that's good to see. BHD is planning to apply for the funding. I wonder if there's like, Amy, do you know if there's like separate TOR funding again this year that the tribes can apply for?
Yep, and in that link it talked about SOAR and TOR.
Oh, good. Good.
Yep.
So Tammy, take note of that. There is some tribal opioid response funding opportunities available.
And I
Cool.
haven't looked
Is
at
that-
it a ton yet, but one of the big differences is that if awarded, we'd be awarded for 3 years instead of 2.
Oh, wow.
Good.
Is that for the state too?
For the state, yeah, the state
for the
would
state,
be
okay.
awarded.
So Amy, that
3 years
would be
instead of
just
2.
like, sorry, that would be just like invitation to apply again, come out, right? For
That's if
SOAR.
the state gets awarded, right?
So we
Yeah.
have to apply first, and then once we're awarded, we would then release an invitation to apply for the state of
Okay.
North Dakota funds.
Okay.
So you guys don't
Yeah.
have to do anything yet. Just sit
Okay.
tight. Hold on. We got to apply first.
Yeah.
And
Well,
then
and
we'll
I
be in
think
touch
our
with you guys.
I think our treatment is ending there, Tor, and I think they got a different grant, so I don't think they're putting in for the actual Tor. I think they got a different funding.
If you write
Source.
for that, Tammy, that TOR grant, you have a high likelihood of getting it. So if
Yeah.
there's some things that you
I
want
don't
to fund,
I don't want to deal with Sam, so
I don't blame you.
it's not a thing. I mean, it's not me dealing with them. It's the process through our chairwoman. So there's a porthole that you have to report on, and it's not easy accessible because it's under the chairwoman. So then it makes some of those reporting issues a big issue. So
Absolutely.
I love working with the state and it being so easy because I do have a whole lot of responsibility compared to a lot of other people in the coordinating position. So yeah, I love working with the state because for me, it's real workable.
Good.
Perfect. Well, thank you for that feedback. Yeah, I agree.
Yes.
Yeah,
You
it's the
guys are
ER
very
comms,
easy to
right?
work with, and I brag you guys up all the time because it's like it's real simple, and I don't think a lot of funding sources and grantees are it works so well. Sometimes it doesn't. So and we have, yeah, we built it to make it work real well, and
Good.
yeah, I had to tell about me and Tom's cultural experience the other day, and they were laughing at me, and I was like, yeah, we were laughing at ourselves, and we were like,
Absolutely.
we
Yeah, our
came a long
relationship
way.
goes back a long ways, so
Yeah, for sure. For sure.
a lot of good times.
Yeah, for sure. I'm glad we're getting the SOAR because we just filled the peer support specialist training. Like we have 34 participants. We filled it like in no time, and there's like, and we didn't even like put it out there because of the first time. We pre-selected just to make sure everybody was going to be in attendance, and I swear we could put on probably 3 more and we could fill them. There was so many people interested in wanting to do that, and I'm like, that's so exciting because that helps with not just SOAR, but it helps with AOD. Now I have resources that are all over here that I can just reach out to, and more activities, more events can happen because it's not just a group of people. It'll be a whole bunch of people doing all events, and
Absolutely.
yeah, so I'm really excited because I think that opens the door for our reservations to have a whole lot of resources.
Good. Yeah, well, it's good to hear. And I'm glad you filled that training. And I believe there's more opportunities for more. So
Yeah.
that's awesome. Hey, any other questions, you guys, or things you need? Well, good. It was good to hear from you guys, and
So,
I'll see some of you at the SAPS training next week, and then at the June in-person meeting. So,
Yep.
All right. Well, take care, you guys.
Bye,
Have a happy
everybody.
Tuesday.
Miranda, I do have a question for you. It's a individual question though.
It's a what? You kind of cut out.
All right, it's more of an individual migrant question.
Oh, okay. Yep. You can go ahead.
Email you or
Yeah, maybe email it to me, Miranda, and then I can get you the answer.
But I'll CC Callie in it too. I just
Yes.
unique opportunity, and I'm just how I can make it work. So
Okay, that works. All right. Well, thanks, guys.
Thank you. Bye.
Bye-bye.